Hello everyone. Thanks for joining us. My name is Dr. David Kulla with Synergy Wellness in New York City. Today we have a case of somebody with a disc herniation, most likely. We don't necessarily have to have an MRI. That gives us that definitive diagnosis, but what I want to talk about is what most people do when they get arm pain or numbness, which you had. You have neck pain, right, with pain and numbness and tingling down into the arm and hand. Most people would go to a neurologist for that, or most doctors would refer you to a neurologist. What they don't know is in many states, New York State in particular, it's within scope of practice for a chiropractor to do an NCV and EMG. And we have one of those machines. They're not cheap, but we have one in the back. And I think a lot of doctors just don't understand that, don't understand really what chiropractors do. And that's why I have this channel, so people can understand what we do. In each state, it is slightly different. So we do NCVs and EMGs. They are expensive tests, so typically insurance does cover it. But that being said, that nerve test tells us if there's any nerve damage, where it's being pinched at the carpal tunnel region, right, in her wrist, or is it up at the neck, or somewhere else in the elbow, and we're able to tell that with a nerve test. But she's on treatment number 5, right? Today's our 5th treatment, so she's had 4 treatments so far. And how are you doing so far?
Pretty good, because I really get improved.
Okay.
Before, I always feel my fingers numb and whole arms, but now it's happened less and less.
Less, okay.
Yeah.
Would you say you see how much improvement? 25, 50% improvement? Or
so far,
less?
it's 25.
25. So in 4 visits, she's had 25% improvement. So we're on track. We expect a minimum of 50% improvement in symptoms in 4 to 5 weeks. So we're right on track with what we're doing here, and we expect another 25% improvement here in the next 4 or so visits here. So we're going to show you what we do for neuropathy, but I'm also going to show you how the brachial plexus works. So I said a lot of you go to a neurologist, and the neurologist will basically just do a nerve test. So at a chiropractor's office, you get the nerve test. You can get the x-rays too if you want, if you need it. And then also you get the adjustment that takes the pressure off the nerve. There's nothing better than a chiropractor for a pinched nerve, especially up here in the neck. Now, if you have a pinched nerve in the neck, yes, it can cause headaches, but it can also cause tingling, numbness into the hands and fingers, and even pain shooting down the arm. So chiropractic is extremely effective for that, and I guess you got referred in by your husband, right? So, okay, so take your glasses off for me, and we're going to have you sit right here, facing that way.
Okay.
So first we're going to start with some cold laser for her, and just inhibit the nerve, calm things down a little bit on that left side, and I'll show you how we do that here in just a second. So this is just an adjunct. This is the Multi-Radiance Active Pro MR5. We're able to do quite a bit here. You could just relax there. And we're just going to go along the brachial plexus. Now, the brachial plexus is a branch of nerves that exits from the base of the neck and the top of the upper back. And that brachial plexus, that plexus of nerves, it has the ulnar nerve, the median nerve, the radial nerve in that bundle of nerves, and sends signals down the arm, and it controls your muscles and your sensation in your arms and hands and fingers. So again, it's right here in her neck. So we're going to go along all those nerve roots in the brachial plexus just to calm them down, inhibit them, reduce some of the inflammation around the nerve roots. And that's just going to speed this process up for her and get her on the path to healing much quicker. So we have the first 4 treatments, we actually didn't do any laser. So the 25% improvement she had was strictly from chiropractic adjustments. We did some traction on her as well, modalities. And the other thing that a lot of neurologists and medical doctors don't know is that they send nerve cases, neurological cases, to physical therapists, which are really soft tissue specialists. And if the nerve impingement is at the spine, they are not really the right person to see. A chiropractor is. And on top of that, not only can the chiropractor run the EMG, do an EMG, read MRIs, read x-rays, take x-rays, but they can also do modalities, do all the physical therapy modalities like laser, electric stimulation, which would not be the best thing in this case, but traction, spinal decompression, things like that. You know, and it's really hard to find a physical therapist that manipulates really well, that adjusts really well. They take a weekend course. As chiropractors, we do not take a weekend course in physical therapy. We take like a year-long, we take the PT national boards in New York State. You have to as a chiropractor. So a lot of misunderstanding in the medical community about what chiropractors do. I still get scratching my head when I see a doctor refer a sciatica case or a brachial plexus issue or disc herniation to a PT initially. Initially, they should be going to a chiropractor, and then an adjunct would be to finish up with PT in that situation, or to do them together in conjunction. So that's what we do here in this office. Okay, how you feeling? You don't feel a thing, do you?
Mm-mm.
Okay, are you tender right here?
Yeah.
Okay, and right here, even more?
Right.
Okay. This will also reduce her pain. So that point I just touched there was a trigger point for her. It's just inflamed, and this is right where the brachial plexus travels, right through here, and then down the back here, the arm. Then it branches off into different areas of the arm, hands, and fingers. Now, if she wasn't improving in 4 to 5 weeks, that's when I would probably refer her out for an MRI, or we would do an EMG nerve conduction test in the back and get to the bottom of, you know, what's going on, where it's being pinched, and if there's any nerve damage. Now, there are a couple other points. If you want to go down the arm and cover everything, there's a lot of different points down the arm. But since she's already improved 25%, we haven't even done any laser. We're just going to do the top branches of the brachial plexus, the roots, where it comes off the spine and just out to the top of the shoulder here. And then we're going to go ahead and start adjusting her here in a minute. So you got about 30 seconds here, okay? And then I'm actually going to touch that spot again, and you're going to see how much better it feels, okay? Okay, let's have you lay down on the table. So what I'm doing right now is I'm checking for subluxations. And yes, I can feel it with my hand. I've also have other tools to check for subluxations, like a surface EMG machine in the back. We also have x-rays to help us determine subluxation, but the best and easiest way is by hand. And you feel that right there? A little sensitivity? So I can feel the vertebra out of position right here. We're going to correct that. And that's the strongest suit of any chiropractor, their tactile sense. And I can feel this right here is more sensitive than it is on this side. Is that correct?
This one's okay.
This side's okay, but this side's more sensitive, correct?
Mostly same.
Same? Okay. And what about here compared to here?
Yeah.
More so on the left?
Right.
Okay. All right. So we're going to loosen the muscles up here in our mid-back. This is one of my favorite tools to use, the PT-LMS, and you need a license. You need a medical license to get one of these. This is not a Theragun like you get over the counter. Much better. Isn't it intense? Yeah. Okay, take a deep breath in and blow all the way out. Good. And again, deep breath in and blow out. Excellent. Okay, one more deep breath in, all the way out, and relax your shoulders here. and turn over on your back. So as you guys can all see, I adjusted below her brachial plexus, you know, T4, T5, T6 region as well, because that's where all the misalignment started. But what happens is one area gets out of alignment and the other areas above and below it start to compensate and shift out of alignment too. And that's what's happened to her. And that's how I know that this is a chronic problem, that it didn't just start 4 weeks ago or a couple weeks ago when I first saw her. This has been gradually building. And her neck is also subluxated right down at the base at C6, which would control the sensation in the thumb and middle finger. And I'm going to show you guys a poster here on the wall which explains the brachial plexus a little bit better. So here's a diagram, a cervical spine diagnosis, but as you can see here, there are different nerves numbered C5, 6, C7, C8, T1, and they control the sensation in these parts of your arms and fingers, as you can see here, okay? Now, each disc has an area that controls. C4, C5 disc controls the C5 nerve root, which controls the shoulder and this part of the arm right here. It's hard for you guys to see that. Hopefully you could see that shaded in part of the arm. And each disc level has a different nerve that exits from it. And those nerves, again, control the arms, hands, and fingers, muscles, and sensation. And below here, we just have a degeneration chart. But hopefully that, you know, helps you understand how the nerves in the neck and the base of the neck work and how they affect your arms, hands, and fingers. Relax here. And relax here. Good. Okay, you're all set. Thanks for letting us show everybody what a chiropractic neurological case looks like. Now, we're going to actually do, hold on, I want to show people a little something else. We're going to do a little bit of traction with her and sort of end it with traction. There's a lot of ways to do traction. We have automated traction called spinal decompression, and then we have this called the Y strap. Lift your head up. Good, and back. And okay. And we're just going to gently pull and traction out her neck. Now this is typically good for anybody with a disc herniation, a disc bulge, or a pinched nerve, except sometimes if you have a fissure, a disc fissure, or a crack in the disc, this or a disc extrusion, this can make you more symptomatic. So you have to be careful about it, and I've seen a lot of chiropractors really yanking on people's neck. We're not going to do that here. We're just applying about 10 to 15 pounds of consistent stretch, and then we're going to come back in. Do you feel an increase in pain when I come back in? Yeah? Mm-hmm. Okay. So that's pretty common to feel that, right? If you have a pinched nerve, when you pull the neck away from the body, you're tractioning it out, opening up the space where the nerve is. So that takes pressure off, but then when you let go, it puts pressure back onto that nerve a little bit, and they feel it for a split second, and then it goes away. Very, very common in the beginning. In a few weeks, she won't feel that anymore. Okay. Okay, gently lift your head, drop it back. And that's it, folks. So if you guys have any questions about disc herniations, neck pain, shooting pain down the arm, numbness, tingling down into the arms, comment below. Thanks for tuning in.